Welcome back to the Hampton Roads Show. People of all ages can find themselves dealing with injuries like ACL tears in knees or rotator cuff problems in the shoulder, and some of these injuries may require surgery. Joining us now is Dr. Manish Patel with Southampton Orthopedic and Sports Medicine Center to tell us how surgery has changed and how he can help using some of the latest techniques. First of all, welcome to the Hampton Roads Show, Doc. You are an expert with knees and shoulders. Let's skip the knees. However, I need a new knee. But let's skip the knee and go right to the shoulder. And if people are at home, they have a little bit of grinding or uncomfortableness, what are the symptoms?
Well, the typical patient will have nighttime pain. That's one of the biggest problems. Difficulty laying on it, burning pain down the arm. They may even occasionally complain of overhead activities, trying to reach up to the top cupboard, reaching back into their wallet. Women will complain about trying to have difficulty reaching into the back as well. And so over time they get weaker and weaker, and then they just can't sleep at night anymore.
And what's the difference between helping them with therapy and then, or maybe surgery?
Well, physical therapy can help. It strengthens your rotator cuff muscle, and that's one form of conservative treatment. A cortisone injection can help if you have what's called bursitis. But when you start having weakness and difficulty laying on it, and therapy and injections don't help, then surgery, arthroscopic surgery for rotator cuff surgery can make a significant difference, and an MRI would help give you that information as well.
Okay, you want to stay active, you want to continue to play tennis or golf or swim or whatever it is, but your shoulder's keeping you back, and you determine that they need to have arthroscopic surgery. There's other methods, but why is arthroscopic the way to go?
Arthroscopic surgery is less invasive surgery. It involves using a camera and with 3 or 4 poke holes the size of a pencil eraser. And with the camera you can pretty much do everything that was done traditionally with an open incision, and fellowship training makes a big difference. And so when you put a camera in there, you can look at it, repair the rotator cuff, and stitch just the 4 poke holes. Less bleeding, less scar tissue, less pain, quicker rehab, and that means a lot more for the patient.
Typical results for the average patient?
Typical results, patients will be on a shoulder immobilizer for about 4 to 6 weeks. After that, they will start rehab, and about 2.5 months, they should be pretty much back to whatever they want to do. A lot stronger, the night pain should go away, and be able to do everything they want.
I'll talk about, you've been teaching and staying on top of the latest methods. Talk about that.
I did a fellowship training in Jackson, Mississippi, specifically in arthroscopic surgery, and now I actually teach other orthopedic surgeons in Chicago as a master instructor on how to convert themselves from an open procedure, traditional way, to an arthroscopic procedure on cadavers, and I feel privileged to do that every year in Chicago. Okay,
we're going to skip from the shoulder to the knee, a completely different joint, but a lot of the same results.
Same results. Arthroscopic surgery, again, can benefit, especially, I do a lot of sports medicine, ACL reconstructions, meniscus tears, and so 3 poke holes, patients go home the same day, minimal blood loss, and quick recovery as well.
And you said that there's no age. There's no age. It covers everybody. You get sports-related injuries from a young age to older adults who want to stay active.
Yeah, more and more actually. Sports medicine is not just for the 18-year-old lacrosse player. It's actually for the 55-year-old weekend warrior. And more of my patients are also becoming more active. So even if you have an ACL tear at 55 years of age, it doesn't mean that you should just sit home and not do anything. You want to lead an active, functional life, and sports medicine is going to get you back to where you need to be.
Okay, I know there's a lot of people that are very similar to me who just put the problem off and deal with the pain. Your advice to somebody who's hurting in pain: fix it, or wait, or you'll know. I mean,
no, you need to get it addressed. Your body is telling you something. One of my mentors told me, if you have a swollen knee, that's a crying knee. You should not have more than maybe a teaspoon of fluid in your knee. So if your knee keeps swelling, there's a pathology there, and you're probably doing more and more damage to it. Just like an oil change, you know, you got to get it checked out.
Okay, my knee's not crying, it's sobbing.
Yeah.
It's been sobbing for a long, long time. And Dr. Patel, you seem like the person who can certainly fix it. They have 2 Southampton Orthopedic and Sports Medicine Centers. One is at 106 Fairview Drive, Suite A in Franklin. Call them 562-7301, or Lakeview Medical Center in Suffolk. Give them a call at 942-9806. Find them online at southamptonnortho.com. or southamptonortho.com. Sorry about that, Dr. Patel. Thanks for joining us this morning, and great advice.
All right, great.